So the month of July marks Psychosocial Disability Awareness Month. This comes at a time when the world's attention is firmly on COVID-19. The South African Federation for Mental Health says very little data is available on the mental health toll as a result of the pandemic. So how should we as countries be responding to this? We're joined by Masutane Modjadji, who's the project leader for information and awareness at the South African Federation for Mental Health. Thank you so much for your time on Newzroom Afrika this evening. With no adequate data to illustrate the issues around mental health at this point in time, what's been your experience on the ground? How is South Africa holding up in terms of issues surrounding mental health since the advent of COVID-19?
So you are right to say that, it's coming at a time when the attention of the world is on the COVID-19. So because the pandemic has yet to reach its peak in the country, we do not have definite statistics showing us the mental health toll as a consequences of yet. But what we are hearing on an ongoing basis from experts is, across the globe is that this could have sweeping mental effects on the well-being of people across generations, and this is because whether it's economically, socially, culturally, we are all just being affected one way or another, and this applies to people with mental health, with pre-existing mental health conditions, and those who might still develop such problems in the future, more now because of this pandemic. And with that being said, we will see more people, some people overcoming the challenges within a short space of time, while for others, they will need long-term intervention to help them cope. And more than anything, the pandemic has really just reminded us that mental health care is really just an equal responsibility of individuals, government, corporates, and civil society, as well as the community as a large. And government has the responsibility of providing leadership on policy development and coordinating multi-sectoral responses to mental health challenges, and also just offering directions to ensure that these messages that are being coordinated do reach the intended recipients, which is just individuals and communities.
Ms. Modjadji, of course, the enforced lockdown, the curtailing of people's freedom and the isolation from friends and family is sure to cause problems among people with pre-existing mental health issues. What are the warning signs for not only South Africans but indeed citizens of the world that may well be experiencing mental health problems for the first time?
So, there's just so many signs, but then psychosocial disability as a mental illness is really just when mental illness is so prevalent, it limits a person's ability to function fully, and as a result prevents them from being able to claim their rights to participate fully in society. For example, it might be impacting on the individual's ability to secure employment or get an education. So psychosocial disabilities differ. It can be episodic, invisible, and often it's not well identified. And so the thing is, it can affect anyone and everyone. There are so many, there's just a lot of social risks that can be a factor and increase the likelihood of a person developing mental health disorder. And we are seeing that now with the COVID-19 pandemic, which is just an example of such risk factor. We've seen people that are affected differently. Some people have lost their means of getting an income. Some have lost physical contact with their loved one, and it's impacting on their mental well-being. And others live with the fear of being ill, and also their relatives maybe are facing stigma because of being associated with people that are known to have contracted the virus. So all these are just important determinants in developing mental illness, and many people who experience mental illness delay seeking help because of the fear that is being, they are frightened by the illness itself, and also just the fear of stigma and discrimination, which is just ingrained in society. And so which is why campaigns such as this, the Psychosocial Disability Awareness Month, are so important in that they are raising important awareness on psychosocial disabilities in the hope that we have more understanding, and also just use correct language that does not discourage people from getting help.
Ms. Modjadji, there's another layer to this, though. South Africa is an extremely diverse place, and the approach to mental health issues differs vastly between the white community, the coloured community, the Indian community, and, of course, the African community as well.
Yes, so that's another problem. I mean, like there are cultural barriers to our understanding of what mental illness is, which is why we are saying that also another problem is also just it being associated and restricted to in terms of like medical terms. And what we are saying as a federation is that psychiatric admissions and also just prescribing drugs on people is not solutions. We need to ensure that people have access to daycare facilities in their communities through community-based organization where they are able to get counseling and mental health services near their place of residence. And because now a lot of our health resources have been redirected towards dealing with the physical impact of the COVID-19, capacitating community-based NGOs and offering the support they need will ensure that we maintain mental health services at all times throughout the pandemic and even beyond this, especially for people who cannot afford in rural areas and those communities where stigma is still very high in terms of like mental health.
Ms. Modjadji, the lockdown in its very nature is going to be telling on people's mental health, those with pre-existing conditions and those that don't even know that they have issues around mental health as of yet. We haven't even begun to address the fact that the economic fallout of COVID-19 in South Africa is going to be particularly bad, which will also be a massive telltale sign for mental health.
Definitely, it's going to be a huge. It's going to have a huge toll on our current health system. And as the organization, we are also saying this month we are going to use it to highlight, not only to highlight the impact the virus has on the mental well-being of people. We are also hoping to start conversation that will also just get us and the government to reflect on some of the mental health challenges that we are facing. Also, this is happening at a critical moment in our country where the National Mental Health Policy Framework and Strategic Plan for 2020 to from 2013 to 2020 is coming to an end. And this is like a piece of that promise to facilitate greater mental health services reform, of which there has been poor implementation. So we hope to use this month to reflect on those challenges, the challenges that we are facing, and the work that still needs to be done. And on our part as an organization, we know that, coming up with policy frameworks and it's going to take time. So for this month, we've also just developed tools that we hope people can use and can benefit from in taking care of their own mental well-being. We have a video which actually just became available today that is available in 5 languages that people can use on how to cope with stress. We also have a My Care book which we developed with partnership in partnership with the Higher Learning Institute, and we hope that this can also just benefit young people in taking care of their mental well-being. We also have member organizations in every province that offers mental health services for free to those who are able to just do walk-ins at their sites.